What are the treatment options available for the breast cancer?
And the most important thing is a surgery. That means the entire breast is removed. There is something called chemotherapy.
Are there any side effects of both?
Forgot to mention that chemotherapy also has side effects which affects the heart.
Can breast cancer treatment may affect fertility or pregnancy?
Definitely, we ask them to go for a storage of the eggs. They suppress the ovary. So during the suppression, we start the chemotherapy.
Okay.
And then once the chemotherapy is over, then we just remove the suppression. We want the ovary not to function. Don't consume meat, especially red meat. They reduce the sexual desire, especially for a woman before menopause. If they put on weight, it is very dangerous because.
So does wearing a bra or using a deodorant cause breast cancer? Sir, as we have discussed general awareness and diagnosis and screening test, let's come to the point which is very necessary, that is treatment and management pattern. So right now, what are the treatment options available for the breast cancer?
See, it is basically a multimodality treatment. That means you have to integrate various types of modalities of treatment for the treatment of breast cancer. And the most important thing is a surgery. So surgery could be a just lumpectomy. That means you remove only the area which is affected.
Okay.
Or it could be a mastectomy. That means the entire breast is removed. These are the two options as far as surgery is concerned. And again, during the surgery, they also address the axilla. The reason for addressing the axilla is that we presume that this breast cancer can go to the earliest spread beyond the breast is the axillary region.
Yes.
So we clear that axilla. So this is how it is been managed surgically. And once the surgery is done, there is something called chemotherapy. So the chemotherapy is again based on what type of breast cancer it is and what is the stage. So these are the main things that we look at. And today we are in an era where there are dynamic changes happening in management of breast cancer. So previously we used to do the surgery and give chemotherapy, and today the days have changed and we give chemotherapy and do the surgery. So that's the change that we have noticed over the last couple of years. And beyond chemotherapy, there are hormonal therapies, there are targeted therapies for a specific group of patients in breast cancer. We use monoclonal antibody along with chemotherapy for better response and control of the disease. And then we have a radiation. Radiotherapy. So radiation is basically to the area where they have removed the breast and the axilla. These are the areas. Depending upon whether should we treat both or only one, we decide basing on the area that has been affected by the malignancy.
Sir, could you just put on light on what is chemotherapy and what is radiotherapy?
See, radiotherapy is by using ionizing radiation, that is X-ray, and you just address the area. Potentially, there could be something which you can't see.
Okay.
So that's called a microscopic disease, which you can't see by a naked eye. You are trying to destroy those cells. That is locally it is done. And chemotherapy is a systemic therapy where, as I told you, that by the time the patient comes to you with a 1 centimeter or 2 centimeter lump, there would have been at least 6 to 8 months of, it would have started 6 months or 8 months earlier. So there is always a chance that from this lump, there could be a dissemination into the body, those cancer cells, which you can't see by any means. So you address them so that you can reduce the recurrence in, say for example, you just remove the breast and you give radiation. They'll come back with liver secondaries or pulmonary secondaries or bone secondaries because you have not given any systemic therapy. So the systemic therapy is basically addressed towards reducing the chances of having a recurrence in breast cancer patients. So that is one. And second thing is they combine chemotherapy with targeted therapy and
Radiation therapy.
yes, chemo and targeted therapy.
Okay.
And there is something called a hormonal therapy. So majority of these breast cancers are influenced by the hormones. So you reduce the hormone production in the woman. So once the hormone is not there, these cancer cells they die on their own. So
Okay.
like how we eat food every day, they need something like hormone for them to survive. So if you deprive the cell with the hormone, they die on their own. So that is one theory, and it is a strong recommendation that we should give hormonal therapy for one group of patients, especially who are hormone receptor positive, but not all.
Sir, what are the hormones basically
Usually,
responsible for?
the two hormones which are responsible for breast cancer are estrogen and progesterone.
Okay.
So these are the we do test to see whether there is any expression of these receptors by the tumor. If that is been expressed, that means it is dependent on hormones. So we
Okay.
give hormonal therapy to counteract that.
What is
Surgery,
breast conservative
that is
surgery?
called BCS.
Hmm.
So as I told you previously, for many days, many years, we used to remove the entire breast, and now we realize that you remove only the breast lump and give radiation, which is almost equivalent to total removal of the breast. Because what happens is, one thing is, if you remove the breast, it's a kind of a social stigma that they will have.
Yes.
They will have a lot of inhibitions going into the society. The women, they're not very happy, and their family life is not happy. So obviously, there is a very high tendency for the depression for the woman.
Yes.
So these are the things which were noticed by many people, many doctors and the scientists, and they found that they should find an alternative way to reduce this. So they came with an idea of just removing that and giving radiation for the entire breast. That is almost equal. So they have done the study, and that had shown both are equally good. That's why they don't do total removal.
Partial
So the
based.
partial removal of the breast.
Yes, yes. Partial part is
And there
removed.
is something called an oncoplastic surgery by which you can also reconstruct this breast.
Okay.
So even if it is been removed completely, there is oncoplastic surgery where you reconstruct. So it's a
Okay.
plastic surgery by which so that they gain the confidence to live in the society. That's the only thing.
So right in India, it's going on oncoplasty surgery.
Yes, everywhere it is going on. Even in our hospital, we are
Okay.
doing oncoplastic surgery for a woman. Even for lumpectomy, also for the defect, we do an oncoplastic surgery to cover it up.
Sir, what is the life expectancy after if a lady suffer with stage 4 or stage 3 breast cancer?
See, the life expectancy in stage 1 is about 80 to 90%, and stage 2 it will fall to 60 to 70.
Okay.
And once it reaches stage 3, it is about 40 50%.
Mhm.
And once it is stage 4, less than 10%.
Less than 10%. So suppose a person suffer with stage 2, suppose it's 40. As per your experience, how many years?
See, many of these patients, it's not like years. Like if I treat stage 2 breast cancer, about 100 patients, I'm pretty sure that at least 60 to 70% of these patients are going to live forever.
Okay. Mhm.
So what I have to prepare myself, or I should prepare my patients, that at least 30% chances that you can have a recurrence. But the beauty today in the science is that we have developed so many new molecules, and there are so many new targets, which is beyond the today's discussion, because there are so many things which have come up, and most of these things and the newer treatments are basically aiming at keeping the patient alive and preserved,
Yes.
with less complications and with less side effects. So there are wonderful drugs which have come into the market now. They are pretty good and very
Sir, apart from
effective.
surgery, is there any kind of conservative management we can go for? If
No.
it is stage 1 or stage 2?
See, stage 1, stage 2, you should go for all three modalities.
Okay.
If you're going for radical mastectomy, that is modified radical mastectomy, we avoid radiation. if it is in stage 1.
Mm.
If it is BCS, we give radiation. Otherwise, they should go for chemo and surgery.
Sir, you told about chemotherapy and radiation therapy. Are there any side effects of both?
Yeah, definitely. In any therapy, we have some amount of advantage and some amount of disadvantages and the adverse effects and the side effects we see. So initially, when these chemotherapy drugs came into the picture somewhere around 20 years ago, they used to cause a lot of nausea, vomiting. That was a big and bothersome for many patients. So today we have a lot of drugs which are very highly effective drugs to control nausea, vomiting, and obviously the chemotherapy has got its own demerits, like you have hair fall, and you get some people, they get diarrhea, they get nausea, vomiting, and the most important thing which many of the patients they can't notice is a fall of blood counts.
Okay.
So what happens is, after we infuse the chemotherapy acts on cells which are multiplying every day. So that's why they lose their hair, and the bone marrow cells which are responsible for control of the bleeding, control of the infection, they all fall drastically, and they pick it up. And so there is a period between 7 to 14 days. That's the little critical period where they can have a dip in total WBC count. So we do give prophylactic growth factors for that to overcome. So definitely things which are unavoidable side effects like hair fall and all these things. But I think we have really improved ourselves in terms of controlling most of the side effects that are caused with chemotherapy today. And that's the reason I think probably many of these patients are very happy to go for chemo, whereas previously they used to avoid chemotherapy.
Yes.
That is one thing. And radiation, it has long-term side effects, like it can affect lung in terms of causing pneumonitis, and it can also affect the function of the cardia. So it can cause damage to the heart. So to avoid that, we have a new technique in our hospital called a deep inspiratory breath hold technique, by which you can reduce the dose deposited by the radiation onto the heart. And again, I forgot to mention that chemotherapy also has side effects which affects the heart. So heart becomes weak. So how do we diagnose these patients? So the patient completes the chemotherapy, they go away, they come once in 6 months or 3 months for a follow-up checkup, and they notice something, that they are unable to climb the steps, or they are unable to walk for a while. And then we just see whether there's anything wrong with the heart by doing an echocardiogram.
Okay.
And the moment we find that there is a weakness of the heart, then we put them on drugs, and we send them to a cardiologist for a review. They evaluate and they put them on the drugs for heart failure. So this is also happens.
Sir, can breast cancer treatment, after getting the treatment done, the treatment may affect fertility or pregnancy?
Definitely, it has any kind of chemotherapy affects the fertility of a woman, and if it is for men, it is for men. So it is like this: like a woman who has not completed the family, we ask them to go for an storage of the eggs.
Okay. Okay.
So we send them to a fertility center, and they can go for a storage of their eggs in the, so that the eggs are freezed. Then we can go for chemotherapy. Those on the, like they have one kid, and they may want to have, or they may not want to have in future. They're not in a position to decide. Then we put them on drugs called GnRH analogs.
Sure.
GnRH analogs.
GnRH.
So gonadotropic hormone analogs.
Okay.
So GnRH analogs, what they do is they suppress the ovary. So during the suppression, we start the chemotherapy.
Okay.
And then once the chemotherapy is over, then we just remove the suppression, and then they can usually get back. But what happens in many of these breast cancers is, we don't want them to have a regular hormonal production, because
Okay.
50% of these cancers are hormonal dependent.
Yes.
So we want the ovary not to function. So they have to finish their family before. If they have not finished, they should store the eggs.
Okay.
They should not do anything beyond that. That's my advice.
Good, sir. If a lady suffer with breast cancer, so is recovery from the breast cancer is fully possible?
Yes, of course it is possible.
Because it comes to many patients' mind that whether I'll be recover fully or not. What
See,
about my family?
that's the problem, like the more post-therapy complications they carry for a few years, and they just don't feel like coming out of that, and they have lymphedema, they have surgical complications, post-radiation complications, and they feel that that's why if a woman undergoes mastectomy, she's psychologically upset,
Yes.
and she feels that she's been isolated from the family, she's not having a good sexual life, and she feels as if she's patient forever. So I think that has to come out of their mind, that once the treatment is over, it's over. But the only thing is, we give tablets for about 7 years for some patients and 10 years for some patients, so that it doesn't come back.
Okay.
So these medication also has got minimum side effects,
Side
like
effects.
they reduce the sexual desire, decrease in libido, vaginal dryness, and lipid abnormalities, that is metabolism of the lipids abnormalities.
Yes.
They put all together, they go into depression, and they feel that still they are a patient.
Yes.
So
So
always it's the positive nature or the positive things. They should create their own aura around themselves, that they're very positive. And the family members also should create something that she is normal. So they should never treat that she is abnormal, or
Yes.
she is. So that's the main thing. So if you give too much of care also, they feel that still they are not normal. If you don't give care also, it is like they say that they are not bothered to take care. So you need to be balanced.
today is also today morning only I met with such a family. The lady is fully depressed due to his lost his limb. He is totally depressed, and but his family, you as you told, na, the family thought that he's see that lady is fully normal, but that lady is also when talking with their family. So she's talking very nicely, but while sitting alone or while doing something, depression is noticed for 10 minutes. I just alone talk with his family. So I told the lady is in depression, so you have to talk with her and try to get out of her this depression, and or else you can help with the doctor. The family told no, it's fine. So you told the same thing today morning only I met.
Yeah, you need to be a little smart enough to balance the situation and go ahead.
What are the lifestyle changes a patient should do before
See,
breast cancer and after breast cancer?
See, it's almost same. I would say that they should eat good food, keep away from smoking, alcohol. There is no limit, like one peg is good or two pegs are good or whatever. I don't believe in all that. So keep yourself away from the alcohol, smoking, eat good food, keep yourself away from the junk food, and regular exercise. Don't put on too much of weight, especially for a woman before menopause. If they put on weight, it is very dangerous, because there is one more additional source of estrogen hormone from the fat. So unnecessarily you are giving a chance. So these are the things. Minimum exercise, like you don't have to lift weights or anything like that, but you just keep yourself going every day for about 20-30 minutes. Good ideal walk should be good enough, and don't consume meat, especially red meat.
But
High fat content food you avoid. That's good for health. Take some nice yoga or something for about 15-20
yoga and
minutes.
meditation.
That's it.
As we discuss, breastfeeding help to reduce the breast cancer. So if a lady, I just same questions what I asked earlier. If a lady is not getting married, so on that cases, if it is genetic, we cannot do anything. But anything precaution, any precaution has to be
Yeah,
taken.
they have to go for regular ultrasound screening from the age of 40.
40, not before 40 is not needed, but after 40 they have to go for screening. And sir, anything or any other thing after any kind of exercises or any kind of food,
Nothing.
special foods?
Nothing.
Nothing.
There's nothing, no special food to consume to reduce your risk or anything like that. Just regular all colored fruits, all colored vegetables.
And what about the hormones?
Hormones they should not take.
If she's not getting married and if that lady is suffering, there may be chance of hormonal imbalance. So on that conditions, is there any chance to get hormone balance on yoga
by using the drugs.
drugs?
So that is very dangerous.
You should not be advised.
The dangerous phenomena. I think we shouldn't. There are some chemoprophylactic drugs like raloxifene, but I would personally say that we should not go for any drug unless otherwise it has got a benefit.
Okay.
So merely a small benefit of in this thing we shouldn't go for. So they can go for what is called a regular checkup, ultrasound. If they find there is something abnormal, they can go for a mammo. If there is something seen, go for a thorough checkup and go for a biopsy or FNA and find out.
Sir, are there any warning signs?
Yeah, when you see there is a small lump felt in your breast, I think you should consult your physician, family physician, or a gynecologist, or any cancer center or anything like that to evaluate whether it's a malignant or not. And if you see any change on the contour of the breast or the size of the breast, or if there is any nipple discharge or a bloody discharge, or if there is any small ulceration on the skin on the breast, then we should immediately consult. These are the early signs.
Sir, what are support is available for patient during treatment?
The thing is, they need some psychological support from the family,
Yes,
and they need spiritual, if they believe in God, whichever religion it is, and then they need support from her or his friends, and definitely from the doctor, physician, treating physician, and the staff members of the hospital. And this is where you can give a positive energy to the patient. And as far as financial support is concerned, most of the treatments are covered under either government schemes, so it should not be a big burden on the patient. So I think it's only the initiation that the patient has to take, that they have to go for treatment. That is something which is very important when they want to go for treatment.
Sir, I am going to discuss about few myths and facts. You tell me whether it's a myth or fact. If it is a myth, then tell me about the fact. So, can men get breast cancer and how common it is?
Yeah, men also can get breast cancer. It's a fact.
Okay.
But it's not very common. When I said 20 to 23 women among the 1 lakh population get breast cancer. So I would say if I see 100 or 200 breast cancers in a year, I would see only one male patient having a breast cancer.
Okay.
And the entire treatment is entirely same. There is no change.
Okay. So does wearing a bra or using a deodorant cause breast cancer?
No.
Wearing a tight bra or...
See, obviously these are the common questions that have been asked by many women. Deodorant, I don't know exactly whether, but anything of that kind of a chemical is not good for health.
Okay, yes.
So I think try to avoid as much as possible using of the chemical. And second thing is using a tight bra that does not cause any black color bra. Some people say that. Is there anything that? But there is no proof that if you use this, you will get, but you will not be comfortable, and definitely
you should not use it.
You should not use.
Are younger women at risk of breast cancer too?
No, older women are risk of breast cancer, not
Okay.
younger.
Not younger.
Not
So it's a
younger.
myth.
It's a myth.
Is it possible for a breast cancer to come back after treatment?
Yeah,
Recurrence.
it's a fact.
Fact.
That's called recurrence.
Okay.
So it all depends. The factors that can influence the chances of recurrence are stage. If it is advanced stage, the chances of recurrence will be high.
Hi.
The type.
Okay.
If it is a triple negative breast cancer, the chance of coming back will be high. If it is an HER2 positive breast cancer, the chance of recurrence will be high.
Okay.
So it's like that.
That depends on the stage and that
Stage,
types
type.
of cancer. Okay. So can a healthy lifestyle guarantee immunity from breast cancer? Healthy
See,
lifestyle.
nothing can guarantee anything.
No.
But only thing is, if you take two individuals who is not healthy and the other one is healthy, habits, as far
Yes.
as habits are concerned, the chances of breast cancer will be obviously less for an healthy habits, a woman who has got unhealthy habits compared to an unhealthy habits. But it could be vice versa, that that woman could have breast cancer, and the one which is not having unhealthy habits also could be
Yes.
not having any breast cancer. So this you can't say, but always without wearing a helmet you can ride a bike. With wearing a helmet you can ride a bike, but helmet is only a protection.
Yes.
So likewise, your healthy habits are your protection. But how, whether there are people who die even with helmet if they're wearing and they meet with an accident, and there are people who survived without a helmet when they met with an accident. So you can't say that, but helmet has been made for a protection. So a healthy lifestyle is also like that.
Yes. Sir, as you have been practicing since 27 years on this field of cancer oncologist, sir, what's your piece of advice for the viewers and the audience, the people, those who are watching right now?
See, basically, I would advise a good lifestyle, for a girl, they should control their emotions and they should control their habits in terms like when I was young, like 30 years ago, hardly I used to see any woman smoking or drinking. And today,
Yes.
we can see a lot of, it's not that they're trying to match men or anything like that. But one thing is, they're more responsible in the society. We treat them in a different way. They're like flowers. So you don't want the flowers to be destroyed.
Yes.
So they have to take care of themselves. So you don't use this tobacco, alcohol. Keep yourself fit. Do some good exercise. Eat all possible types of food that you have. That means fruits and vegetables. Try to reduce your consumption of red meat, especially. Keep yourself away from junk food. These are the good habits, and try to get married as early as possible. So
Okay.
for me, early is different, and for somebody, early is different, so that you have a better protection. So if you are getting married after 30 and if you become pregnant after 32 or 33, your protection that has been given by the God's gift is lost.
Okay.
So conceive before 30, complete your family. You may be having so many priorities in your mind: your vehicle, your flat, your
Yes.
position in the company, all the professional life, and all that is very important. But your life is also important. So if you have to think about your life, marry and then finish your family early, so that you get very good protection.
Thank you, sir.
Thank
you
you
for
very
joining
much.
our podcast. And today you have shared a lot of information. Hopefully, this information will be used by our audience. And what we have discussed, it's a kind of general kind of things. So hopefully they will get better outcome.